Earlier this month, the Trump administration laid off more than 800 staff, or at least two-thirds of employees at the National Institute for Occupational Safety and Health, also known as NIOSH. The agency was established in 1970 to conduct research and make recommendations to prevent work-related injury and illness. It's part of the Centers for Disease Control and Prevention that falls within the Department of Health and Human Services. According to a ProPublica report, these cuts included 7 out of 8 members of a group that investigates when a firefighter dies in the line of duty. The administration's cuts will also disrupt a first-of-its-kind study looking into cancer in firefighters and a program that provides assistance to 9/11 first responders. For more, let's bring in Mark Olalde. He's a reporter for ProPublica and author of that article. Mark, thanks for being here.
Thanks so much for having me.
Why is this program so vital?
So anytime a firefighter, whether it's wildland firefighter, residential, military, dies in the line of duty, that fire department can reach out to NIOSH, can reach out to this 8-member team and say, please investigate, please tell us what went wrong. After that report is finished, the first step is it goes to the family, helps give the family closure. It helps the family understand what happened to their loved one. And then it goes to the entire firefighting community. And the community then gets to fix its SOPs, think about what gaps it has and how it fights fires, and really try to, as they say, learn through tragedy and make sure that this accident doesn't happen to other firefighters.
One of those former employees told you that the team had been looking into the deaths at 20 fire departments when they were laid off. What's going to happen to those investigations?
Those 20 are still a bit up in the air, but more than likely they're done. More than likely, those 20 will not be finished. The investigations will not be completed. They'll not be sent to the families. They'll not be sent to the firefighting community, and they'll most likely just not publish.
You also spoke with 5 NIOSH employees who were either led or contributed to firefighter health initiatives and got layoff notices on April 1st. What did they tell you about why they were laid off? Like, what were they told?
So they sent me their layoff notices, and in, I guess, a bit of cruel irony, the layoff notices said, essentially, you're redundant. You're not being laid off because you were doing a bad job, but you're being laid off because your position isn't necessary, or there is someone else doing the same work you're doing. And these messages ended with thanks. Thanks from the Department of Health and Human Services for the work that you do. And frankly, this was kind of salt in the wound to my sources at NIOSH, who were very confused why their kind of first of their kind studies, research, investigations, et cetera, were deemed to be redundant.
Right. I'm guessing that they would say the first of their kind study, that they would argue their positions are not redundant.
Exactly.
A large portion of the staff working on the National Firefighter Registry for Cancer were also laid off April 1st. And a bill establishing this registry was actually signed into law during President Trump's first term. As of 2023, more than 23,000 firefighters had signed up to participate. What happens to these firefighters and the work the staff had been doing?
Exactly like you said, more than 23,000 people signed up. The goal was to get 200,000 firefighters, volunteer firefighters, wildland firefighters, again, all different types of firefighters, current and retired, many of whom have cancer, many of whom are simply concerned about the cancer causing chemicals that are in their gear. What does that mean for their health? Or the smoke they've been inhaling for a 30, 40-year career. What does that mean for their health? The portal where you could sign up to be a part of this study, where you could kind of, check your information, very, very quickly after the April 1st layoffs went offline. The IT department was not spared. No one was really spared from these cuts. And so I talked to researchers who worked on this, and they told me their hopes and dreams for the types of findings they really hope they could dig into with this unprecedented trove of public health data. And it's tough to continue a study if you don't have scientists to look at the numbers.
I have to be quick with you, and I regret that because this is a loaded question. But do these cuts to all these programs make firefighting more dangerous than it already is?
Absolutely. It's going to be a difficult fire year. Fire years are only getting longer in wildland fire because of climate change. We've seen cuts to staffing. We've seen cuts to funding in terms of the federal firefighting force. And on top of that, we've now lost many of the people who are studying the long-term health implications of fighting fire. So it's a more dangerous time to fight fires now than it ever has been.
Well, Mark Olalde, thank you for reporting and thank you for coming on.
Thanks so much.